Imagine being a medical professional on call during a crisis. How do you handle it efficiently and effectively? It's a scenario that many medical professionals face. The answer lies in the critical role of on-call protocols and principles. These are not just guidelines, but lifelines that navigate the turbulent waters of medical emergencies. In the heat of the moment, it's easy to feel overwhelmed. That's where the on-call protocols come in. They provide a systematic approach to quickly identify and manage problems. Whether it's a sudden cardiac arrest or an unexpected allergic reaction, these protocols offer a roadmap for immediate action. They ensure that every professional, regardless of their experience level, can respond effectively to a crisis. But it's not just about responding to emergencies. On-call protocols also cover routine matters, like conducting a patient interview or performing a physical examination. They standardize the process, ensuring that no stone is left unturned. This leads to more accurate diagnoses and improved patient outcomes. Let's also not forget the importance of proper documentation. In the medical field, the saying, "If it's not documented, it didn't happen," holds true. Documentation is the backbone of medical practice. It provides a record of the patient's history, the care provided, and the response to treatment. But documentation isn't just about ticking boxes. It's a legal requirement that can protect you in the event of a dispute. It also aids in communication between healthcare professionals, ensuring everyone is on the same page. In the end, understanding and implementing on-call protocols and principles isn't just about doing a job. It's about making a difference in the lives of patients. It's about providing the best possible care, even in the most challenging circumstances. So, whether you're a seasoned professional or a budding medical student, never underestimate the power of on-call protocols. They're the compass that guides you through the complexities of medical practice. Understanding these protocols is the first step towards effective patient care during on-call hours. Because when it comes to saving lives, there's no room for error. Every decision, every action counts. And that's why protocols and principles matter. The pressure is high and time is of the essence. How do you diagnose and manage on-call problems? Let's delve into this crucial topic. The first step is the initial assessment of the situation. As a medical professional, you are the first line of defense. Your ability to quickly assess a problem, its severity, and the potential risks involved is paramount. This assessment should be comprehensive, taking into account the patient's medical history, current symptoms, and any changes in their condition. Next, we move on to prioritizing issues. In an on-call situation, multiple problems can arise simultaneously. Prioritizing allows you to deal with the most pressing issues first, ensuring that patients are stabilized and immediate threats are addressed. Once the immediate threats are taken care of, it's time to make those quick and sound decisions. This is where your medical knowledge and experience come into play. You need to understand the underlying cause of the symptoms and then formulate the most effective treatment plan. This could involve prescribing medication, ordering further tests, or even preparing for surgery. However, remember that you're not alone in this process. Collaboration is key. If you're unsure about a diagnosis or treatment plan, don't hesitate to seek help from your colleagues. A second opinion can provide a different perspective and may offer a new approach to the problem. Now let's talk about a scenario. Imagine you are on call and you receive a call about a patient with severe chest pain. Your initial assessment will involve gathering information about the patient's medical history, current symptoms, and recent activities. Once the initial assessment is done, you need to prioritize. In this case, the chest pain would be the most pressing issue. You need to rule out conditions like a heart attack, which can be life-threatening. Then, you need to make a decision about the next steps. Based on the information you've gathered, you might decide to order an electrocardiogram to check the patient's heart activity. At the same time, you may start the patient on aspirin, which can help prevent further heart damage. But what if you're unsure? What if the patient's symptoms are not typical of a heart attack, but you can't rule it out entirely? This is where seeking help comes in. You could consult with a cardiologist or another experienced colleague. They might suggest additional tests or a different treatment approach. Dealing with on-call problems can be challenging, but with a systematic approach, it becomes manageable. This approach involves assessing the situation, prioritizing the issues, making decisions based on your medical knowledge and experience, and seeking help when needed. Remember, you are an important part of a larger medical team, and your role in diagnosing and managing on-call problems is crucial. Your ability to assess, prioritize, decide, and collaborate can make a significant difference in patient outcomes. In conclusion, on-call situations can be high pressure and time-sensitive. However, with a systematic approach, you can navigate these situations effectively. Always remember to assess the situation thoroughly, prioritize the issues, make informed decisions, and seek help when needed. Remember, a systematic approach is key to handling on-call problems. Documentation is more than just paperwork. It's a vital part of patient care. But how does it fit into on-call protocols? Just like a successful surgery relies on the surgeon's skill and precision, successful on-call patient management relies heavily on concise, accurate, and comprehensive documentation. Think of it as a compass, guiding the path of patient care, contributing to the correct diagnosis and treatment, and ensuring continuity of care. Let's delve a little deeper into the significance of proper documentation of on-call problems. Imagine this scenario. You're on call, and you encounter a patient with complex symptoms. You make decisions, administer treatments, and then you hand over your shift. Without proper documentation, the incoming healthcare professional may struggle to understand the patient's condition, the steps you took, and why you took them. This could potentially lead to mismanagement of the patient's case, impacting their health outcomes negatively. So, what should you include in your documentation? Details matter. Start with the patient's identification, the date, and time of the encounter. Record the patient's complaints or symptoms in their own words if possible. Include your observations, examination findings, and the results of any investigations. Document your assessment, the treatment plan, and any advice given to the patient. Remember, too, that documentation isn't a one-time thing. It's an ongoing process. Update the record as the patient's condition changes or as new information becomes available. This helps create a comprehensive picture of the patient's health journey, allowing for better care coordination and management. But let's not overlook the elephant in the room. Inaccurate or incomplete records can have serious implications. They can compromise patient care, lead to misunderstandings, and even result in legal complications. For instance, if a patient suffers an adverse event and there's a need for a review or investigation, your documentation serves as a factual account of what transpired. If your notes are unclear, incomplete, or incorrect, it could potentially put you in a difficult position legally. Moreover, good documentation also plays a pivotal role in medical audits, research, and education. It serves as a learning tool for medical students and junior doctors. It allows for the evaluation and improvement of healthcare services. And it provides critical data for research, contributing to the advancement of medical science. In essence, documentation is a cornerstone of good medical practice. It's not just about ticking boxes or filling out forms. It's about ensuring that every patient receives the best possible care, that every healthcare professional has the information they need, and that every decision made is transparent and accountable. So the next time you're on call and you're tempted to rush through your documentation or skip it altogether, remember its significance. It's not just about the here and now, it's about the long-term care and well-being of your patient. Precise documentation aids in effective patient management and protects you legally. Volume status assessment is a vital skill for on-call professionals, but how do you do it accurately and efficiently? Let's dive into this crucial topic. The first step in assessing volume status is a thorough physical examination. This involves checking the patient's vital signs, including heart rate, blood pressure, and respiratory rate. It's also important to evaluate the patient's general appearance. Are they alert and oriented, or do they appear dehydrated and lethargic? Observations like these can provide valuable clues about a patient's volume status. Next, look for signs of volume depletion or overload. Examine the skin and mucous membranes for signs of dehydration, such as dryness or decreased skin turgor. Check the eyes for sunken eyeballs and the neck for jugular venous distension. Assess the extremities for edema, a sign of volume overload. Listen to the lungs, as crackles might indicate fluid overload. And don't forget to examine the abdomen. Ascites, or fluid buildup in the abdomen, can also be a sign of volume overload. Once you've completed the physical examination, it's time to turn to lab tests. These can provide objective data to support your clinical assessment. Useful tests include blood urea nitrogen, or BUN, and creatinine levels, which can indicate kidney function. Serum electrolyte levels can reveal imbalances that might signify dehydration or fluid overload. A complete blood count, or CBC, can show hemoconcentration due to volume depletion or hemodilution from volume overload. Urine output and specific gravity can also provide important information about volume status. However, interpreting these lab values requires clinical judgment. For instance, a high bun to creatinine ratio might suggest dehydration, but it could also be due to a high protein diet or steroid use. Similarly, a low hematocrit might suggest volume overload, but it could also be due to anemia. Therefore, always consider the patient's overall clinical picture when interpreting lab results. Now let's talk about managing volume status. This often involves fluid resuscitation for volume-depleted patients or diuretic therapy for those with volume overload. But remember, the goal is not just to correct the volume status, but also to identify and address the underlying cause. For example, if a patient is dehydrated due to excessive vomiting, treating the vomiting is as important as rehydrating the patient. The importance of accurate assessment and management of volume status cannot be overstated. It's a skill that can prevent complications, guide treatment, and ultimately save lives. It's also a skill that requires practice and experience. So don't be discouraged if it seems challenging at first. With time, you'll become more adept at recognizing the signs of volume depletion and overload, interpreting lab results, and making sound clinical decisions. Mastering the assessment and management of volume status can be a lifesaver in critical situations. And that's what being an on-call professional is all about. So keep honing your skills, and you'll be well equipped to handle whatever comes your way. Being a medical professional on call requires more than just medical knowledge. What are the aids that can help a house officer? As we delve into this topic, it's important to note that the world of medicine is vast and ever-evolving. No one, not even the most seasoned medical professional, can hold all that knowledge in their mind at once. That's where aids come in handy. One of the most traditional aids for house officers are reference books. These can range from comprehensive medical textbooks to pocket-sized handbooks. They are loaded with essential information, from symptoms and diagnostic criteria to treatment plans and drug dosages. A well-stocked medical library can be a lifesaver in the middle of a challenging on-call shift. In today's digital age, however, we're seeing a shift towards more technology-driven aids. Medical apps are becoming increasingly popular among house officers. These apps, often available right on your smartphone, offer quick access to a wealth of medical information. They can provide up-to-date guidelines, disease databases, medication information, and even diagnostic tools. Some even offer interactive features, like quizzes and case studies, to help you hone your skills. But let's not forget one of the most valuable aids a house officer has: their colleagues. Whether it's a fellow house officer, a senior doctor, or a specialist, your colleagues are a rich source of knowledge and experience. They can offer advice, second opinions, and can be an extra set of eyes when you're dealing with a complex case. Aids, however, are not meant to replace fundamental medical knowledge and skills. They are there to supplement and enhance what you already know. They can help you navigate tricky situations, stay updated with the latest medical advancements, and make your on-call shifts smoother and less stressful. Remember, the ultimate goal of using these aids is not to make your job easier, but to provide the best possible care for your patients. Because at the end of the day, that's what being a medical professional is all about. Utilizing aids effectively can enhance your efficiency and accuracy as a house officer. Let's summarize what we've learned today. On-call protocols and principles are foundational to effective medical care, providing the structure for swift and accurate responses to patient needs. A systematic approach to diagnosis and management is crucial, enabling us to navigate complex medical situations with clarity and precision. Documentation is not just paperwork, it's a vital part of the on-call process, ensuring continuity of care and providing a solid basis for decision-making. Volume status assessment, too, is a critical aspect of patient management, helping us to maintain a patient's balance of fluids and electrolytes. And let's not forget the value of aids. These tools, whether they're medical equipment or decision-making algorithms, are an indispensable part of the house officer's toolkit, enhancing our ability to provide optimal care. Remember, being a successful on-call medical professional requires knowledge, skills, and the right approach. Stay prepared, stay efficient.